Yeah, this is Medic 9.
Medic 9, send traffic.
We have a 57-year-old male with difficulty speaking and right-sided weakness, possible stroke.
We have a 44-year-old female with a history of recurrent DVTs, presenting with left-sided headaches for 4 days and difficulty speaking.
Past medical history of hypertension and diabetes, non-compliant with meds. ETA 5 minutes.
ETA 10 minutes. Copy?
Copy.
All right. Good morning. Calvin?
Yeah.
How are you? I'm Dr. Osborne. All right, so when Calvin came in, we got the call from the emergency department. We heard that this was a middle-aged gentleman with right-sided weakness and confusion. Frequently, we perceive patients as being confused when they have a problem expressing themselves, and what Calvin really had was a problem with his language. His stroke was on the left side of the brain, and in 95% of persons who are right-handed, the left side of the brain controls language, and that's why we call it the dominant side, the dominant hemisphere.
That was one of the hardest time of my life because it was so sudden for me. I got up in the morning. I thought it was a normal day for me. One thing I remember saying, something is wrong. I can't say it. Something is wrong with me. I don't know. I want to express myself. I can't talk. I can't see properly. And all I remember kept saying, I'm tired. Why am I so tired? Why can't I remember anything? But I was talking conversation, yes. I would say something, but 2 seconds I have to ask it the same thing all over again. But I didn't realize what was happening because had I known the signs and stuff like that, I could have said, oh my God, I'm getting a stroke. But I can't tell you I'm having a stroke because that was the last thing on my mind. When they told me I had a stroke, I'm trying to figure out what is a stroke. I've heard it, but I have no idea of a stroke. What is all the signs of a stroke and stuff like that?
Unfortunately, the timeline with which he presented to the emergency department did not make him qualify for a medication we call TPA. And simply what it is a clot-busting medication that you can give to patients who present within a reasonable timeline for ischemic stroke.
We're going to take you to the CT scan to make sure that the type of stroke you're having is not from a bleed.
So Alicia had several days of headaches on the left side. She had problems communicating effectively. She had problems with memory, and then she had weakness on the right side.
Okay, can you follow? How many do you see?
So on the day of the stroke, I was actually home for a few days from work because I didn't feel myself. Not only I was tired, but I didn't have the strength. I just kind of feel sick.
And it showed that she had a bleeding type of stroke. However, the stroke that Alicia had was a fairly uncommon type of stroke where it was actually caused by clot in the drainage system of the brain.
Dr. Osborne and his team, he kept coming, and every time he would come, he would check my knees, check the right, the left side, and then he would ask me, what's this? Looking at the fan, and I'm just like, I know that. How come I know? I'm just trying to understand, why don't I know to say fan? I know what it is, but it's just not coming to my memory. I remember at one point in time, I knew the doctor was going to come in a particular time. I would say, okay, that's a fan. He going to ask me about fan. I said, fan. And I would say, that's a pillow. And I said, pillow. And I said, fan. And I focus on the fan. And then he would come, because I hear his mouth. And then he comes in. And then he said, what's that? I forgot. And I was like, I know what it is. I just tried to remember it. I just said it. And he would laugh. Dr. Osborne would just laugh and said, I know you know what it is,
Your life can change so fast. And some of us are not, some of us never get a second chance. I got a second chance in life. I know what my situation is. I know what I have to take. I know what I have to do. I try to keep my doctor's appointment. I need to do all the things, simple things that we don't want to think about. I do them now.
What's next for Alicia? Alicia is blessed, highly favored, and she's healthy and doing well. And no other stroke is going to come on her.
Time is brain, and time to call 911 is important because the quicker your stroke is evaluated and treated, the better your outcome and the less likely you are to have disability.